Hi everyone and welcome back to my channel. So for those who don't know, I'm Alicia and I've been interviewing inspirational people to find out how they've become the person they are today. Now this week I interviewed aesthetic nurse Sarah Cheney to find out how she's become such a success and how she's gone on to win awards. Here's how it went. To begin with, if you could just introduce yourself.
I'm Sarah Cheney and I'm a nurse practitioner from North Wales. I've been in the aesthetics industry for 12 years now, and I am also a key opinion leader for and trainer for Zeo Skin Health in the UK. I do a lot of presenting. I've got two businesses. One of them is Clinic Success, which is a coaching business for clinic owners. But my primary business is my clinic called Pure Perfection Clinic, which is based in North Wales, not far from Chester.
Fantastic, thank you very much. So, how did you get into the aesthetic industry?
So when I was a teenager at school, I had psoriasis on my legs, which was really affecting my confidence to do PE and things like that. And I had some treatment with some steroid creams, and then when I was going through puberty, all of a sudden, all these really purple stretch marks appeared. And when those stretch marks came, I was really, oh my god, I really couldn't cope with them because they were like big bruises, really. And lucky for me, my mum took me to a clinic in Chester. Well, it was to see a dermatologist in Chester that then referred us to a clinic in Liverpool.
Mhm.
And I had some treatments, laser treatments on my stretch marks. But while I was in the waiting room waiting to have those treatments, I realised that there was lots of advertising in the waiting room of what was available as medical treatments for not just skin diseases and disorders, but also for aging as well, and things that could affect your confidence, and that you could really make a huge improvement to people's psychological state as well as their physical state. So it became a bit of a fascination at that time, and I remember I used to send away for large brochures. They don't do so many print brochures these days because everything's online, but at that time there was a lot of print brochures on the market, and I'd send away for all these brochures, and I was fascinated, and I couldn't wait I wanted to do that as a job, and that was my dream, to do it as a job. But I was still in school at that time. So, it was many years later that I was able to fulfill my dream and start my own clinic. And I wanted the clinic to be like, I used to watch a program which is probably before your time, called Extreme Makeover, and 10 years younger and things like that. And I used to think, wow, how can I create an environment where people can get made over? So we do all the aesthetic enhancement, from the Botox, the fillers, the skin, and then we have a beauty background behind that where they can have their brows and their lashes and their nails and things done. So it kind of is like a transformation. And then if they do want to go for surgery, we have a link to our local plastic surgery clinic. So I would just refer them there. So it is kind of like that extreme makeover that I always wanted, in a way.
Which is lovely, and it's lovely like how you've kind of experienced it yourself, so now you're wanting to kind of help others. So when you were doing your training to become an aesthetic nurse, did what was the training process? Did you have to go through like a nurse training first, or how does it all
Yeah,
work?
so I was a nurse. I trained as a nurse in the year 2000, and I wanted to be a surgical nurse. I ended up being. I wanted to work in the things that were the most interesting, and I found it surgery, theatre, A&E, that kind of thing, most interesting in my career path when I was training. So I was a theatre nurse when I qualified, and an endoscopy nurse, and I worked in the hospital for many years, with this dream still in the back of my mind. And I also liked beauty. I liked going to have beauty treatments myself. So I was struggling to get the hospital to put more training my way. So I decided to do a hobby of doing all my beauty training in the evening. So I'm actually a dual qualified nurse and beauty therapist. And I did that just as a hobby to keep my mind engaged. But in the back of my mind, it was always something I wanted to get into. But where I worked in the local general hospital, they didn't have a big plastic surgery and dermatology department. So there wasn't, I suppose, the opportunity to learn there. So I decided to start self-learning and investing in a lot of courses to progress my own career privately rather than doing it through the NHS.
Working full time and running like your dream alongside like being a nurse was quite strenuous. What was the challenges, what you faced along that?
So it was hard because I worked in my job in the NHS full time, and then I launched my business and kept my job in the NHS and tried to work it alongside that. So I was technically working for about 18 months, 2 years, two jobs to try and build the business. It was really hard, to do that because I had to make sure I had an income stream coming in, but I had to also start building up my business in the background. So it was just overwhelming, really, because I was working so many hours. And eventually, I was forced to make a decision to leave the NHS, which was very daunting at the time, but it was the best decision that I ever made. People always ask me how you become an award-winning clinic that's successful, and there is no magic wand. There is no special answer or special recipe. It comes from hard work, training and experience, and becoming better and better. And I am really happy now. My business is in a position where I love going into clinic. I'm busy all the time. We're in demand, but I would never sit back on my laurels and think, oh yeah, it's there now. It's where we want it to be. You've always got to continue to strive for perfection and be your best. Because the moment you're not interested anymore and it just becomes monotonous, you should hang up your coat and not do it anymore. You've got to be engaged and interested, because that patient journey is a special journey that they need you to handhold them through, and that takes time and effort, and you've got to have a passion as well to do it, I would say.
You mentioned there about like being perfect. Do you think being perfect has helped you to win the awards?
I think that perfection is overrated, and trying to make sure that my business is run perfectly and everything to do with how we operate is perfect, I would say, has probably held me back, because not everything has to be perfect. You've just got to ensure that you plan meticulously what you want to do and follow your dreams and follow your plans. So perfection is overrated, and certainly in the business that I'm in, I would say there's no such thing as perfection, that everybody is beautiful in their own way. But certainly patients do come in looking to, they all want to look like the best Instagram selfie they can ever look like, and that sort of thing. I think that's really unhealthy, and it's not a great way to be. You have to look naturally beautiful, and you don't want to change your features. You want to make sure that somebody looks healthy in their skin and feels confident. But perfection, I would probably say, is it's overrated, and you can almost hold yourself back by wanting things to be too perfect. And I also think that in the life that we live in today, especially like when you think about stuff like social media, you see people posting their perfect picture of their perfect, idyllic day and their amazing cake that they've baked and things like that. But life's not perfect for anybody, I don't think. And I think there's too much pressure, especially on young people today, to think that they've got the perfect life with the perfect hair and the perfect, car and the perfect image. Perfection is it's all about happiness and finding a good work-life balance, and health and happiness and confidence is everything. I think, there's no such thing as perfection.
That's really lovely to hear. How would you say someone who is a perfectionist, I know you mentioned like it could hold you back, how do you overcome that? How do you get to the stage where you go, do you know what? Perfection, basically what you just said, perfection is overrated.
I just think that, I've done a lot of courses and followed a lot of super successful people in the industry. And the more that you do and the more experience you get, you realize that, wow, I remember so many years ago that I fixated on this document that, it had to be perfect. For example, the website had to be perfect before it was launched for anyone to see, just in case somebody said something about it being wrong. Well, it doesn't matter, because people are not looking at those finer details. They'll be looking at snippets of things to find out about who you are as a personality, what your ethics and morals and opinions are, and whether you're a credible practitioner. It doesn't matter if you haven't crossed the T's and dotted everything perfectly. That's just one example of many things. And I think it's not good for mental health. And I've certainly learned that with the stress levels of wanting things to be perfect over the years. And I see it with patients every day. People coming in saying, oh, I've seen this picture in a magazine and I need to look like that. And I just say to them, well, you're not that person in the magazine. And for a start, that picture is image that's how you can be if you, I don't know, buy that cream, or if you wear this top, or whatever it is. But that's not the truth of real life. Real life is that we do have imperfections, and I think that makes us who we are.
Most definitely agree on that one. Now, last year, 2019, you won the Aesthetic Nurse of the Year award. Can you just talk me through the process of being nominated for the award and how you won?
So the Safety and Beauty Awards is something that I've followed for many years, and I think it's a great thing for trying to raise the standards in the medical aesthetic industry, because the regulations are not great. So I'm really behind the brand of what they do and try to make sure that consumers are kept safe in the industry. And I'd been to some of their events before, and then I was nominated by patients and also industry colleagues, because they said that I'd worked really hard and I'm always wanting to ensure that people are getting the right treatment, and that I always give it my best, and that I live with passion. So I had a lot of nominations from people I'd worked with over the years, and also like from the customers that come to the clinic. So that's how I won. I never dreamt that I would win. I went to the awards with the vision that, wow, I've got nominated and shortlisted to the final 10. And that's a national award. So I was competing with London clinics and Harley Street, which I thought was, for a small clinic in Wales, that was a huge thing for me. And I just thought, well, it was such a nice experience to go and be alongside other professionals and enjoy and celebrate the industry. And then when they called out my name, I was really shocked.
Well, congratulations. I mean, I bet that was an amazing experience as well.
It was an amazing experience. It was nice, after the hard work that I've put in over the years, to be recognised for that. And I think, it does just give you a little bit more credibility that you've worked really, really hard, and, people recognise all the stuff that you do to make sure that your patient journey is amazing, but also to help your colleagues with the training that I give them as well.
You talked about like the rules and the regulations, obviously, as you mentioned, as a nurse before going into aesthetics. Do you think that people should be trained as a nurse, should have that, I suppose it's like doctor insight before they go into the industry?
Most definitely. I think you should have a broad knowledge of medicine before you go into any speciality. You should know how to deal with patients' basic conditions, and know what to look for as things that could potentially go wrong, or things that are not suitable for people. General things, for example, if somebody come in for a medical aesthetic treatment, you need to make sure they're not allergic to anything that you're using, that they haven't got any contraindications. And that comes with having experience in medicine, working in abroad. I mean, I worked in lots of surgical wards and in lots of very stressful environments where people were coming for operations and things. So I'd had a broad spectrum of experience of how to deal with the patients in different walks of their journey, and how to consult, how to communicate with them. And I wanted to help others with their confidence. Whereas I think the medical aesthetic industry is branded as a like luxury industry, where people think they can go into it and earn a lot of money and do very little. And I think that's where the problem lies, really, because if you're really doing it properly to a standard, and you're part of all this insurance and all the safety boards, and you buy everything that is the best to make sure the patient is, really safe, using clinically proven safe products to ensure a great delivery of care, then it's more lucrative than working in any other business or any other part of medicine. It's just that what people tend to do is they do it as a side business and buy. There's a lot of unregulated products like dermal fillers on the market, and things that people go and buy cheaply, and then they put a premium on it. It's really, really dangerous. You know, you're touching and going invasive into the patient's skin when you're treating them, and you can cause a lot of problems. There has been lots of incidences where patients have had some real traumatic um, side effects from treatment that hasn't been done very well. So it's really, really important that someone has got a medical background for a start, but not just a medical background, because being a doctor or a nurse or a dentist does not make them an amazing practitioner or a credible practitioner. As we know, in every walk of life, you know, there is good and bad in everything. It needs to be somebody that's qualified, but somebody that's passionate and doing it for the right reason, that they're really interested in the speciality and really interested in helping people. Because I think if you chase money, you might have a few successful years, but soon enough a consumer would see through that. And if you're not providing amazing customer service and a really good experience and a safe experience, then those patients won't come back to you.
I mean, we've all seen the horror pictures like online on Google where someone's had, I don't know, lip filler and it's gone completely wrong and it's awful. What would you say to someone looking to get treatment?
So when people are thinking about having a treatment, they need to think about, first of all, what is it they want treating and why, and then what treatments are available to treat that indication that they want treating. What are the pros and cons of all those treatments that are available? And then when they've figured out what treatments they want to have or think they want to have, then they need to look at, right, so what's the qualifications of the people that operate these clinics that are offering them? How long have they been doing it? Have they got success stories that they can share with me? Or can I speak to a patient that's already had it done? It needs to be a safe, insured clinic where the clinic operator and owner is somebody that is really has the patient's safety and patient care as the forefront of their practice, as opposed to let's sell them the next best deal and off you go. Because often patients come to clinics asking for treatments that it's not the right thing for them. For example, somebody might come into clinic saying, oh, you know, I've really got really saggy here and I would like to have a treatment on there. Can you put some filler in there to make it look better? And I would always say to them, well, we need to look at the root cause, and that's the most important thing. Why is that looking a little bit heavier than it did a few years ago? And we look at the anatomy and how it changes with age, and how we can restructure that by treating the cause as opposed to chasing the lines and making people look very strange.
How would someone go about checking all them factors that you mentioned?
I think it's really important that they have a consultation and they go to clinics and have a look around. They can look online at their profiles, but recommendation as well from somebody else that's been and had a credible treatment. There is no real structured way and a tick off way to look, but if they're part of Safe Face, which is a very credible safety checker where they'll come and check and inspect your clinic to make sure that it is regulated. If they have part of the big organisations, for example, nurses are part of the British Association of Cosmetic Nurses, which is for our industry, that they're fully insured, as well as, but experience, you know, they should have experience in what they're doing, and they should be able to show you some of their patient journeys to see what they can have done. And it's important that people are realistic with their, it's important to be truthful and honest, I think, because often patients come with an expectation and you can't just say to them, yes, you will have that result if we just do that, because often it's a journey. And certainly for us, it's a journey that starts with skin, because if your skin and the canvas of what you're seeing is not amazing, no matter what else you treat them with, it'll never look its best and it'll never last, because you need to treat a healthy skin to get the best results.
And how do you get that healthy skin? What's the best way?
We in our clinic use prescription grade skincare called Zeo Skin Health. So we always assess the patient's skin, taking photographs and a full medical history. For example, if you had acne, we'd be saying, well, how long have you had this problem? What medication are you taking? When did it start? How's it been treated? What have you tried? What's failed? What's been good? How's your diet? And then we look at the diagnosis of what it is potentially, and we look at a treatment pathway to treat that. So a prescription of creams for that person to get rid of the disease or disorder. After we've cured the problem, if they then come back and say, well, how can I get rid of the scarring, or how can I improve my loss of volume in my face, that's when we'd be looking at other treatments to treat it and maintain it with skincare.
Okay, so it sounds very much like it's a process. It's not like you're going to walk in and walk out and it's all done and you look completely different. It sounds like you've got to go through that motion as such to get to your end result.
It's a journey for sure, and there's no quick fixes. And I think, you know, sometimes people go to clinics and they want everything done in one day. And that would look strange because you would have a complete transformation overnight and people would be like noticing straight away. But B, it's not safe to do that. I think we need to condition the skin to good health first, making sure it's tight and fresh and glowy with no sunspots, aging, and there's no lines and wrinkles. And then once we've treated that, we look if there's anything else needing treating. And if they require further treatment, we do that as part of a process over months and months, not over weeks.
Okay, so in terms of nurses, they're known to be quite empathic in general. So with your patient, or so quite caring people. Would you say, obviously, you've had your own challenges? Would you say your empathy has changed towards others in any type of way?
So for sure, you know, with my own challenges of having major surgery for my illness, which was breast cancer, I feel like I know what it feels like to, especially, you know, I'd had psoriasis as well. I know what it feels like to have my confidence knocked and feel, you know, shy and scared, um, hating my scars and things like that, and hating my skin. It certainly has made me more empathetical to patients, but I was always a caring person before, and I always really cared about my patients when I worked in a hospital environment. And I don't think that's because I'm a nurse. I think it's part of my personality. I mean, I've met many nurses along my journey of having treatment for my breast cancer where they have no empathy and they've not really, you could tell that they weren't really interested or didn't really reside with what I was going through. Whereas I met other nurses on my journey that they completely understood and they supported me through everything. So it goes to, yes, you know, nurses are more, they're trained to be more communicative with the patient and have a better bedside manner, but that's not true of all. I think it's a very individual thing.
Like you say, when nurses aren't as empathic of like what people are going through, I find it actually quite upsetting. You just think like you want someone to kind of be there for you. Now, you mentioned that you had a lack of confidence. How have you overcome that?
For me, I've gone on my own personal growth journey and followed some inspirational industry coaches for business and life. And that has really helped me. I mean, when I was unwell, I had some counselling within the NHS as part of the pathway, which was terrible. It was kind of like almost like they'd read out of a textbook. And it was the fear of dying of cancer. You know, that was a huge thing. And the counselling that was offered to me was at the hospice, which was the worst place in the world to have the counselling because that's what you feared. So that was the last place you wanted to turn up when you were going through your cancer treatment because that's what your biggest fear was. But when I asked them about that and said it needed changing for patients going forward, they said that was the only place they had an office available to do the counselling. And I just thought that was shocking. You know, that was absolutely diabolical. And I'm reading out off a piece of paper when I'm telling her how I feel, she's just giving me an answer that isn't really the right answer. I thought it's not going to help me at all. So I did some mindfulness, and that was really good because that kind of helped you get back in control. And that's a really good thing to do in life in general because life's so busy. And then I found a guru that I had followed on tutorials and YouTube for a while, but I'd never ventured to any of the training. But since then, I have been on a few of the courses, and I believe that training like that has really helped me. And I now have a coach from that training that is helping me to move forward. And don't get me wrong, there are times where we all feel a little bit vulnerable, and you go back to thinking, why me, why have I been through that, and I'm at such a young age. It's natural to slip back and feel that way, but then I have coping mechanisms to get me out of feeling that way and to move forward to the next phase.
So you said about the mindfulness. Would you mind just explaining exactly what that entails?
Yeah, so the mindfulness course, I went on a course that was 10 sessions every week, and you went to mine was in a group, a small group, where he would teach us how to meditate to music and relax and focus on your breathing, stay in control. And you had a CD and a book to help you carry on that at home. And he said that you should do it once a day, every day, to ensure that you feel like you've got headspace and that you don't get stressed and foggy with all life's trials and tribulations. And there's lots of free apps that you can get now with mindfulness on there. One of them's called Headspace, I think, and that you can just listen to. It's just taking some time out of that rat race of life or whatever you're in, and trying to have gratitude and think about the things we have got that's a positive thing. So it is something that was good to do as part of an everyday practice.
Okay, thank you for that. Now, going back to your aesthetic business, what would you say is the most sought after treatment?
The most sought after treatment? Well, that is quite a difficult one, because obviously everyone's different and their treatment journeys are different. I would say that lots of people ask for Botox all the time in clinics, and it's not always what they need. And lots of people ask for fillers as well. But it's about ensuring that when the patient comes in for a treatment, that you do a full assessment on them and ensure that you treat them to what you think is going to give the best results. And often that isn't the right answer. Botox is a quick fix to diminish lines and wrinkles, but it certainly is not going to improve skin quality with texture and pigmentation and rosacea and acne and things like that. So it's very different. I think overall people are seeking to look fresh and look like a best version of them in a natural way, so that they can feel confident in their own skin and not have to cover it up with makeup. And I think if you can hold their hand and make them feel safe and share and help them through their journey by going through it with them, then you've got a chance that they're going to follow your principles and have an amazing outcome.
So over the last, say, 3 years, have you noticed an increase in the aesthetic industry? I know it probably used to be renowned for being more of like what women want, whereas I know quite a few men have started having filler, having the different treatments. Have you noticed a change?
So for sure, the aesthetics industry is one of the fastest growing industries, and certainly since when I discovered it, when I was having treatment myself as a teenager, it has grown and grown and grown, and the technology's grown. There's so much available now. So definitely, and I think, yes, more men do have treatment nowadays than they ever did before. I think it's great that people take, there's things available to help you look fresh, but that people take pride in their appearance and want to keep themselves looking as fresh and glowing as they can. So it's definitely a huge growing industry. And I think that will be the case going forward, especially with more technology on computers and social media, where people want to look good on their image, on their Instagram profile and things like that. I think it will grow and grow.
Brilliant. So finally, I just have 10 very quick questions to ask you. So, question number 1, what's the worst thing for your skin?
The worst thing you could ever do to your skin is to wear a moisturizer.
Okay. Best skincare product?
The best skincare product, well, the best skincare brand is Theo Skin Health, and the best skincare product would depend on what was the condition we were treating on your skin. But certainly, most people today wear moisturizers because they think that that's what they need. But the key is that the skin is really, really good at hydrating itself. And if you wear a moisturizer, it slows down that natural hydration from within the skin, causing skin dullness, laxity is going to be lost, and you're going to get sagging. And that's why lots of people's skin does not look good with age, because they've abused their skin with the wrong creams.
Okay. Would you like to go to the awards again?
Yeah, I would definitely. I'd love to go to the awards. Just, it's great to network with other professionals in the industry. It's great to support these events. And sure, it's great to win an award and be nominated, to be recognised for all the hard work we do in the industry.
Best way to remove makeup?
So cleansing the skin with, I use the Zeo cleanser to cleanse my makeup off. The biggest and most important thing I would say about makeup is that you should wear a mineral makeup that's not full of harsh chemicals that damage the skin. And you should wash it off really well before you go to bed at night. So I always do a double cleanse in the evening.
Okay. Have you ever had treatments?
Yes, I have lots of treatments. So I use Zeo Skin Health on my skin, and currently in lockdown, I've done 2 at-home aggressive retinol peels to ensure that my skin's in tip-top condition. I've also had Botox and fillers, and I've had semi-permanent makeup on my skin as well, on my eyebrows, on my eyeliner, on my lips, and on my nipples, to make sure that I look as good as I can. And I also think it's important to have treatment, not just because I want treatment, but how can you explain to somebody else that this is the most amazing thing you can have if you've never had it yourself and you can't feel it? You have to practice what you preach and experience every experience that your patients experience, so that you can actually tell them the truth about how it feels, how long is the downtime, and the results that it gives. Because not every treatment out there that says it does all these different amazing things, not every treatment is credible and is going to do that.
Most definitely. Facial wipes or cotton pads?
Cotton pads for sure, used in tepid water, and the Zeo cleanser. Never face wipes. They're full of alcohol, so they will dry out the skin and cause broken veins. And certainly they do not remove all your makeup. It's just lazy. You can use them to clean your worktops and wipe a baby's bottom, but no, don't ever use face wipes if you want to have great skin.
Acid peels, yes or no?
Yeah, definitely. Peels are great for the skin because they're going to stimulate the skin to work better. They're great at removing surface imperfections like dead skin cells, fine lines and wrinkles, pigmentation. Deeper peels are also great for deep pigmentation disorders and scarring. And yeah, in their place, with the right practitioner and the right technology, you can achieve amazing results. And it's definitely something I do to my own skin once a month.
Cool. Recommended skincare for breakouts?
So if it's breakouts, there's many different forms of treatment. So if it's just general breakouts, then you want to be using a salicylic acid wash to clear the skin and get rid of all the debris. But if it's acne, they need more, more strenuous. Now, when we're looking at products to treat the skin, it's important to look at the ingredients and their clinical pathway, but not just the ingredients that are in the product, but their delivery mechanism. Because you might buy a product on a high street that says it's 1% retinol, but if that has no delivery system to get it into the living cell, that's going to sit on the surface of the skin and do nothing. So it's about the delivery action and the ingredients and how they work to stimulate the cell and to treat the root cause of the problem. That's why you need to look at the science and the clinical evidence and the trials and where the products are made and who they're made by, because there's lots of hype in the market about all these things that do amazing things. But I can tell you, I've tried and tested a lot of these things, and they're not what they say they are on the tin.
Okay. Best way to relax?
Best way to relax is to take some time out and, go for a walk, do some meditating. But certainly you should take time out. And if you're working in a busy environment where you're working lots of hours in the day, it's good to take short breaks because your productivity drops after a while. And it's also good for your mental health. You know, exercise is another great thing that helps you feel good and gets rid of your stresses. But making sure that you've got a good working life balance is really, really important, because people tend to these days work too much and take too much on, and then it becomes overwhelming, and that's when it affects us mentally.
And one motivational tip to stay positive.
So, motivational tip to stay positive is hang out with the tigers if you want to become one. If you want to be super successful, you need to hang around with the right influencers. So you need to find a group of people who you want to be like, that are successful, doing what the things that you want to do, that are great at giving advice and support, and that are really there for you and genuinely there for you. If you want to be successful, find a mentor that you want to be like and follow what they do.
That's brilliant. Thank you very much. Now, I hope you all enjoyed that interview. There's quite a few things that we can learn from that interview. However, there was a couple of main points that stood out to me. The first one I would like to talk about is when Sarah was talking about perfection, and that being a perfectionist can hold you back. So it's so important to make sure you plan of what you want to achieve. Put it down on paper, write your plan, and you will achieve your dreams. As a lot of people say, if you fail to plan, you'll plan to fail, and that is so important for everyone to remember. So if you've got a dream, make sure that you put it down on paper and you plan how you're going to get there. Now, the second point that I would like to talk about is when Sarah was talking about mixing with the big cats. That is so important for everyone to know, because if you want to be someone and you want to be better and better yourself, then you need to mix with those people who are better than you, who are doing well, so you can learn from them, you can learn from their mistakes, and eventually you will become just as successful as what they are. Now, you can follow Sarah here. If you have someone that inspires you, comment below. I'm always so interested to find out who others find inspirational. Likewise, if you have an inspirational story to tell, comment below, drop me a message on social media, or even drop me an email. On Sunday at 4 o'clock, I'll be sharing my first ever radio interview where I co-hosted Shire Sound's breakfast show with Charlie Stone. If you've enjoyed this video, give it a thumbs up, comment below, let me know what you think, and don't forget to hit subscribe. See you all on Sunday. See you later.